muffled on the phone, but probably can't hear that. Can
You'd
you?
be surprised.
Hello, my name is Dr. Ericha Scott. I'm a licensed professional clinical counselor and also a licensed drug and alcohol counselor, as well as a board-certified art therapist and a registered expressive arts therapist in the state of California. I've been a therapist for almost 30 years. I was hired first in 1985 by Care Unit Hospital. I was hired to work with drug addicts and alcoholics in a 200-bed rehabilitation center, residential. My first year I had no experience. I had one class in psychology and no training. But by the end of my first year as a drug and alcohol counselor, my clients had the lowest relapse rate of any other therapist, 25 to 30 therapists. I believe that reason is because of my use of the creative arts therapies as part of treatment with those who have addiction, grief and loss, and trauma. That year, my supervisor said, "Oh, Ericha, you're an artist. Why don't you use art therapy?" So I said, "Well, what should I do?" And he said, "Oh, just have people paint their world as it is today and how they would like it to be with or without drugs." So I started with that. About the same time, my brother, my beloved younger brother, was hospitalized with a brain mass. He was hospitalized because the brain mass had affected his ability to walk, it affected his balance. It also had affected his speech, and he was stuttering. Just to get up out of his hospital bed to the bathroom, he had to hang on to furniture. So he was very alarmed and anxious. I was also very concerned. But since my brother and I had done art together as children, I had brought all my art supplies with them. And I asked him to consider drawing the brain mass as if it was a monster. So he did. So then, using a technique by Bernie Siegel, I asked him to shrink the monster on the next page. And we did that probably about 9 or 10 times until the monster was just the size of a dot. So I didn't know what to expect. I was a neophyte counselor, therapist. Just thought, well, maybe if nothing else, it'll reduce his anxiety. Give him something to do to distract him from what's happening. Both of us could not have been more surprised when the next day his brain mass had disappeared overnight. The doctors couldn't explain it, and they discharged him. They sent him home. He had no symptoms, and he was fine. So we know he had a brain mass because they did a CAT scan. So this is pretty solid evidence that he went from having a brain mass that was affecting his speech and his balance, his ability to walk, to no brain mass overnight. So that, to me, was riveting. I had been praying for a direction, for which way to go with my life. I'd been an artist. I was thinking about maybe being a counselor. I wasn't sure, and this was, for me, a very important piece of information from which I chose to study art therapy for the rest of my life because it was so compelling. So from there, I had to think about, all right, before I go back to college and study this in depth, why did art help that year? Because not only did it help my brother with a physical ailment, it helped my clients with addiction. And one reason I believe is that my spiritual practice. Art was an extension of my spiritual meditation and my faith and my belief that people can heal. Another, I believe, is that it's like a magic wand for me. It's just one of those tools that comes naturally to me. It shows up when I need it. The third reason I believe is because as a child, art was very beneficial in my life. In 4th grade, I failed it the first time. I was almost going to fail it a second time. I was on my way to failing 4th grade twice when I overheard my teacher whisper to my mother, "You know, she loves art, so why don't you hire a teacher?" to give her private lessons. And so my mother did. She hired this wild beatnik, beret, long hair, earrings, flip-flops. Well, this was in the 1960s, and then that was pretty radical. So he would take me to paint murals and oil paintings, and he enlivened my life with oils and color and form and shape and creating magic on campus, really. So by 5th grade, I was reading on a college level. I really believe art was a very important aspect of that shift in my life, that dramatic shift from failing to reading college level. I've been studying art therapy for a long, long time. I have 11 years of college. I have published research with UCLA. I've been recognized for my work as a therapist. And while I couldn't conclusively say art helped me read, I believe it was a significant contributing factor. And if nothing else, it helped me care enough to read, to be engaged in the world. Since that time, I've lectured quite a bit on art therapy. I know a lot about the science and the research on art therapy. Art therapy is a little bit difficult to research in an experimental, quantitative way because of the nature of art. There's so many variables. But we can say that art makes a significant improvement when all other variables are controlled, especially for people with post-traumatic stress disorder, addiction, eating disorders, grief and loss, trauma. So there's certain areas where it functions better than others. So we also know that art helps people stay in treatment longer, to finish their treatment goals. So we know if people leave treatment prematurely, that their ratio of success drops. And so it's very important for people to stay in treatment, to care enough about treatment, to be engaged enough in treatment, to stay until treatment's done, until it's over. So I don't know a better way to process trauma than art, whether it's music, dance, poetry, singing, screenwriting, mask making. In fact, we can invent something that hasn't been invented yet. I've seen magic happen with clients that were so stuck. In one case, a woman I know or knew 20 odd years ago had been a dancer. She, because of her trauma and her addiction, had quit dancing professionally, even though she had danced for a long time as a professional. So I asked her to consider dancing the sexual assault from her childhood that was holding her back. And so I have to say I was a little bit anxious. I wasn't entirely sure how this would evolve. But today I can say it's the most beautiful dance I have ever seen. And so while sometimes trauma can be a block, and I also believe it contributes to addiction, and there is evidence that it contributes to higher levels of relapse in those that have an untreated trauma history. In her case, we used dance to help her reclaim her talent and her skill and her profession, as well as help her become sober. So I've seen beautiful, beautiful examples of this over and over again. So I invite you to join me and to do art with me, or some form of creativity, so that we can use a creative process to help you transform. Thank you.
Awesome.
Great.
Cut.